I've worked for the NHS for 28 years. I qualified as an OT in 1986 and I've had various clinical roles in practice development, research and involvement. And my latest move has been into HR. And a lot of my colleagues described it as me moving to the dark side. But I have to be honest and say that it's actually been a very receptive environment, and I still say that my experience of HR is that of a manager and working through those policies and procedures. I don't have their background and expertise, and I guess the message that I would give is that everybody has an expertise to share. It's just about valuing that. My title is Workforce Recovery Lead, and I do think that my title does describe perfectly my role. Workforce is all about transforming the workforce and developing a strategy that includes and is relevant to all staff, not just those experiencing mental health problems and those specifically employed because they have a mental health problem. It's a strategy that has relevance to everyone who has lived experience of trauma or mental health. Recovery is all about ensuring that Trust HR policies and processes remain true to the values of recovery, instilling hope, control, opportunity and an optimism for the future. And a large part of my role is about creating the culture by giving a strong message of valuing everyone's life lived and experiences. We actually have developed a peer support strategy. It was finally written, I think, just a couple of months ago. It's gone to our steering group. And that supports the Trust's ambition of having 2 peer support workers in every team. But I guess today I'd like to share with you or focus on the first 2 of those goals. Julie's already spoken about peer support, as has Emma. And I'd like to share with you just some examples of plans and actions that we've achieved to date. And isn't just me, it isn't just Julie, it's my HR colleagues, it's our service users, it's everybody within our organisation who are supporting what we're trying to do. And it is an exciting time with multiple opportunities to get involved and make a difference to our workplace and our relationships with our service users and each other. So to take the first goal about developing a flexible, responsive workforce whose behaviour is aligned to the positive values. I believe passionately that we need to employ people and support our current workforce to know when they've had enough and they need the support of others. I want to develop a culture where it's okay to say how we are going to, or indeed how we are looking after ourselves. In order to achieve this, we need to think about this pre-employment. And I guess when you think about what do I mean by this, an example would be that we will ensure that there is a values message in all of our person specifications, which will enable us to ask questions about how this experience contributes to how you do your job and can be part of the guidance for interviews, and will help us think about the values that an individual holds. We will review, revise and implement recruitment selection training to raise awareness of the relationship between recovery, employment and reasonable adjustments. We need to think about what are reasonable adjustments and collect and make a list of adjustments that work and have lots of them to refer to and give ideas. And there can be contradictory things on the list. What works for one person may not work for another and vice versa. We want to develop new starter packs that reinforce the values of recovery. And I'm in the process of developing a recovery impact assessment tool so that we can look at all of our HR policies and other policies in the Trust that relate to our workforce. I don't think this needs to be very complicated. It just needs to hold us true to the values of recovery. In induction, we'll develop a looking after staff slot or a values slot. We'll produce a health and wellbeing fact sheet based on current staff stories or hints and tips via our Living in Both Worlds group, which I'll share with you a little bit later. One thing we know is that staff will suffer physical and verbal abuse or death of a patient. And we've drawn on relatively recent news reports of training available for train drivers who may experience the devastation of someone committing suicide in front of their train. We're going to, well, we've already established a task and finish group with people who have experienced the traumas at work and these other things that cause distress, to help us work through what needs to be done to ensure it's genuinely co-produced across communities, producing stories and bringing people together around issues, rendering them normal to be expected and spoken about openly. But it goes beyond that. The news report talked about the train drivers and the training that they needed, but what about the people who have to clear up the mess? And I think that that's the message that I would give you from today, is for each little task that you think you're going to do and overcome, there's 20 million other things behind it. So I talk about being able to retire in 3 years' time because I have mental health officer status. But actually, in order to complete this work, I think there's probably another 30 years' work to do. We're all about developing pathways for people to enter employment. There are some scary statistics out there for young people in particular who, if they don't have a job by the time they're 24, they may never have a permanent job. So thinking about the people who use our early intervention services and other people who use our different services, we've got a strategic approach to developing a work experience or a work scheme within our organisation. And this takes us through from looking at developing the 1 week placement where you get somebody phoning up and saying, my daughter's got to do a week's work experience. And you run around and you try and coerce your friends, through to developing a placement scheme over 12 months where we will provide people with 3 placements which will all the time build towards their CV. It has a workbook that they complete. And the last bit of that 12 months is all about developing CVs, going for job interviews and looking at roles within our own organisation. We develop longer placements within all our services. If we look at our trust, I think that we can provide placements in all sorts of careers other than sort of frontline care. There are electricians, there are catering, there are hotel services, our gardeners, our accountants, our PAL service, our communications department. The list is endless. And we're looking at developing internship style approach. In particular, training peer support workers is very costly, and there isn't necessarily going to be a job at the end of it. But what we're trying to encourage the people who've been through that training is to think about going on an internship where they actually experience the role of being a peer support worker until such a time as the post is available. I mean, my daughter's on an internship now, so she's kind of getting the gist of it, really. We're looking at actually supporting our current workforce, those people who perhaps have experienced trauma at work or have developed a mental health issue. And their current job role is no longer relevant or appropriate to them and they're really struggling. I believe passionately that it's all about retaining their employment. So we're looking at developing creative processes where people can actually have tasters of a different career path for themselves within our organisation, rather than just routinely going through our HR processes and dismissing that person at the end of them. We have a strategy for developing staff wellness plans, which will become part of the supervision process. We have a group called Living in Both Worlds, which is a growing number of staff who actually work in services or work as part of the trust and actually have experience of using those services as well. And this is just a little publication that we've put together. And this group of people are really supportive to me and to Julie and others in the organisation by giving their time generously and their own stories and experiences as a way of helping us make appropriate changes. We're developing modules in the Recovery College that are co-produced and facilitated, where we can actually talk with staff about disclosure and how to tell your story. We're developing supportive training for line managers and team leaders to equip them to support people with lived experience in the workplace. We're developing support systems in the workplace with buddying mentors, developing healthy conversations and lots of resources for people to draw on. We want to develop staff support advisors who are trained mentors who can offer peer group meetings, as peer support is important to us all. We're also looking at developing a health and wellbeing strategy where we can actually really consider what options there are available for our current workforce in terms of supporting them to remain well, happy and successful by their own definition, not by the trusts.